Hey, I'm Dr. Steve Ranicki with Dr. Ranicki's Creating Wellness Center in Savannah, Georgia. And in this video, I'd like to discuss the concept of there being any risk with a chiropractor causing a stroke. In the time that I've been practicing, I've seen a few news stories about it. There was a Playboy model who had seen a chiropractor and had a stroke, and a few other celebrities where they made that connection with. And plenty of people will tell me that their medical doctors told them that if you're going to see a chiropractor, that's fine. Just don't let them touch your neck. They could cause a stroke. So here's the science of it. If a person has torn one of the main arteries of the neck called the vertebral artery, and that artery has a tendency to tear because it takes kind of a funny turn as it comes up into the skull, it turns 90 degrees backwards and then turns and takes another 90-degree bend up. And those 90-degree turns make it a little bit of a susceptible spot. That joint has the ability to stretch that artery a little bit and give it the risk and potential of tearing. And it can happen sometimes just from holding your head in a funny position, such as when you're up underneath the sink trying to look up and see what's wrong with the drain, or things like that. Certainly car accidents are another good way of making that artery tear a little bit. So if that artery tears, then of course you're going to send platelets to that area. And platelets are a type of blood cell that causes clotting. So you get a little bit of a clot in there, and then that clot has the potential to start to decrease blood flow up to the brain and also then decrease oxygenation. And there's going to be some symptoms that'll come with that. And two of the more common symptoms with that type of problem is either neck pain or headaches. So when people are having neck pain and headaches, very often they do something about it instead of just deciding to live with it. They decide they better go see somebody because it seems to have come out of nowhere for them, or it seems to have started ever since that car accident. So they go see a doctor. Now sometimes they go see a medical doctor and sometimes they go see a chiropractor. And there was a research study done back in 2008 when they looked at when a person presents to a doctor, whether it be a chiropractor or a medical doctor, with the symptoms of neck pain and or headache, what's the likelihood of them having a stroke? Now, if it's chiropractors causing the stroke, you'd think that surely there would be some noticeably higher percentage of people going to the chiropractor having strokes than people who went to the medical doctor. Well, what they found was that the incidence of stroke when people go to the doctor for either neck pain or headaches or both was almost exactly the same. There was little to no difference. Slightly more actually when people were going to the medical doctor. So what that tells us is that the stroke is already in process, meaning that the reason that those particular people are having the neck pain or the headaches and wound up having a stroke is that their vertebral artery was already torn. It was already creating a blood clot. That clot was on the verge of dislodging and blocking blood flow to part, if not all of the brain, and then causing that stroke. And that's a terrible, horrible thing, obviously, for those people. But it is an unfortunate reality of our life, is that we don't live forever. We're not immortal. We do get hurt. And in those situations, that injury will sometimes produce symptoms like neck pain and headaches and cause one to go to a doctor. The fact that they had the same risk, whether they go to a chiropractor or a medical doctor, would also suggest that it's not even like the medical doctors are better at recognizing that this is a stroke in process and that the vertebral artery has been torn. It's the same likelihood of either doctor recognizing that because headaches and neck pain are so very, very common. And it would be unlikely for any doctor to think that, uh-oh, neck pain, headaches, this must be a stroke. Let's immediately rush them to get an MRA, not an MRI, but an MRA, where that's where they put dye in your blood and they can see where blood flow is and isn't going very well, using the same kind of technology as an MRI. It wouldn't make any sense. You first start with something more conservative first. So in the medical world, they'd start with painkillers, muscle relaxers, things like that. In the chiropractic world, we would start with determining if there was anything on an x-ray that looked like a structural problem that might be causing this neck pain and headache, and then we would use an adjustment to fix that. And if that person is in the process of having a stroke, if they've already got that tear and they've already got that blood clot, it's just a matter of time before that clot blocks something. It doesn't matter what they do, whether they're going to get a chiropractic adjustment or not, they're going to have a stroke. If they stayed home and did nothing, they're still unfortunately going to have that stroke. So it's an unfortunate thing, but there really isn't any increased risk of people having strokes when they go to the chiropractor. In fact, the incidence of having a stroke seems to be a bit lower. The risk of having a stroke in the general population is somewhere around 12%. 12% of the population is going to have a stroke at some point in their life. But studies that have looked at the incidence of stroke in chiropractic have found that it's a little less than 1 out of every 1 million chiropractic patients will have a stroke. So that puts it somewhere below 1%. It's like 0.0001% of people who see a chiropractor are going to have a stroke. So it actually appears that seeing a chiropractor might be slightly protective against a stroke, which would make sense because remember, as we said in other videos, the whole point of chiropractic care is to improve the function of your nervous system and to make it where your body can heal itself, repair itself better. And if it can do that better, it also might have a better chance of avoiding a stroke happening in the first place. And a little less likely to have had a stroke if you go to a chiropractor than a medical doctor for the symptoms of neck pain and headaches, suggesting that you may already be having a stroke in process. So with all the wonderful things that chiropractic can do to get somebody back to healing and repairing themselves, it just really saddens me when I see people are being frightened away from it by fear propaganda. All right, so thanks so much for watching that. I'll have other videos where we'll talk about the safety of chiropractic in general, and appreciate your time. And if there's anything I can do to help you, please let us know at Dr. Ranicki's Creating Wellness Center in Savannah, Georgia.